Okay, I'd like to invite my student Sabrina to share her thoughts. So Sabrina, rather Dr. Sabrina, is an Ayurveda Vaidya. And in our class, we have about roughly half and half from the Ayurveda background and from the biology background. So Sabrina, can you share with us what you feel, given what you've learned so far for about 9 months now, how this would be useful for a Vaidya in terms of their practice?
Hi, Megha. Am I audible?
Yes.
Okay. So far, I'm not a very like experienced clinician, but still, so far, what I've understood is that studying this course, it gives you a different perspective to everything. So you get a different language in which you can convey your treatment to your patients. So you don't have to, start from the right basics of Ayurveda and tell them about the whole Ayurveda and then give them about the details about the treatment. You can explain it to them in a language they can understand, which is unfortunately modern biology. We can try to make it both equally understandable, but right now it's in current scenario we have to go with modern sciences help take the help of modern sciences to explain something to someone. And often it's a big difficulty, when we start with vata pitta kapha. It's a very big difficulty to convey our treatment to a patient. So that is one thing I feel like would be helpful in further clinical practice. Also, it helps you understand our medicines better. So, since we are learning about pharmacology and pharmacognosy, you understand about each and every ingredient in a formulation. You understand about how it works in your body. You understand what can be the alternatives. You don't have to always go with a particular medicine. You can understand that you don't always have to go with a complicated medicine. You can go for simpler medicines. You can go for one medicine for many diseases. So all these alternatives are open to you, and it makes you understand all this better. So these are things I think which are unknown during our BAMS, because some of the other time it's like this disease is equal to this medicine. Sometimes that's how we understand it. So it's not that you can explore a lot of other options. Um, Also, it since it's everything is research based, you get a particular eye to certain things. Like you start noticing patterns, you start noticing similarities in your patients, you start noticing things which you weren't noticing before. So all those things also will help you, understand a disease better and to tackle it better. So that is another thing which I thought might be helpful in further practice. So it might even inspire you to formulate a drug from whatever you studied, or maybe take up a clinical research with your patients. So these are all the possibilities which are open to you once you finish this course. That's what I think.